Greetings of the day. Welcome you all to the Iron Talk Show with Legends in Neurology. Another episode brought to you by Indian Academy of Neurology. Today, we meet another legend, a renowned clinical neurologist of our country, Dr. Amitaabh Varma, who is an institution in himself. Presently, he is Director of Advanced Neurology Care Center, New Delhi. He was born on 14th of July, 1948 in a holy city, Allahabad. Later, he was brought up in Madhya Pradesh in Bhopal. He did his medical training, MBBS, from Gandhi Medical College, Bhopal. He did his MD medicine from this college only. And afterwards, he came to AIIMS, New Delhi for doing DN in neurology. I have been knowing him for last 22 years as a clinician of repute. I had visited his house, rather palatial house in scenic forms on several occasions. The man who always wears white clothes. Let me welcome man in white, Dr. Amitaabh Varma, sir.
Namaskar.
Namaskar, sir.
Namaskar, Achal. Thank you very much.
Namaskar, sir. Namaskar.
That's so nice of you to speak so kind words. And let me say, greetings of the day for all the listeners also, for all the viewers.
Thank you, sir. So it has been a long journey of life. Now you are 75 years almost. 50 years as a clinician. And of that, 46 years as a neurologist. People who love to know how was your childhood.
Sure, Achal. I will tell you. Well, let me tell you, apart from being born in Allahabad, I must first pay tributes to my parents who are my guru, architecture, especially my father and my mother. My father was a very brilliant man, even while he was doing his DLED in English literature in Oxford University. He was continuing to wear khadi, and the khadi good suits, need not be kurta pajama, right? And also he was absolutely teetotaler, smoker, no smoker. Whereas, and he rose, and he's a philosopher, he wrote 27 books. And from varied subjects, not only T.S. literature, T.S. Eliot, on which he is supposed to be an authority, but also on spirituality and also on different aspects of Indian society. My mother was first lady to have topped in intermediate of UP in 1920s, 30s. She was gold medalist, first woman to get gold medal in mathematics in Allahabad University. Then again a gold, second time double BA. She got gold medal BA Sanskrit also. She sacrificed all her qualification only for our education. So I went before both of them, departed souls. They only guided me, both of them, but especially my father, who was my architect and who told me what to do and what not to do at particular time, but never forced me. He showed me the path only. Choice was always mine. Thank you. So from there, I must tell you, we had a very interesting childhood, more exposed to nature. I was used to do painting, playing. Everything was done by me, whatever has to be done. But then one more thing. We were 5 brothers and sisters, 5 years. I was the eldest of them.
Big family, sir.
Right, a big family. And that's why we believed in the very Indian cultural traditions. And with that sort, we had compassion, empathy for every one of us. We used to be together as like a family, and for the other people who are employed with us. Well, after that, this is myself in the school days. There also I was wearing white. It looks like that. That's interesting. And then
it comes from childhood days, sir. White dress.
Yeah, you are absolutely right. White has been some other. Now I'll tell you later on when I was in. Now I had been doing astrology for years together, so I will tell you significance later on. So there are my mother, my mama, and my sisters. This was when I was about in the higher secondary school. We used to have higher secondary school, right? All of them have, unfortunately, two of my other siblings. He was a general manager in BHL. He is no more. And my youngest brother, who was also professor of pulmonary medicine in one of the medical colleges in Bhopal, private medical college, he had also passed away. So we are only three left now. So, well, it was very, every person did well. My mother saw to it that we were educated so well. So was my father very keen on that. So
I came to know from sources that you used to write civil surgeon against your name while being in school as well. Why you wanted to become a doctor?
well, I'll tell you. I used to write civil surgeon definitely before my name. The reason is very clear. Before that, I will tell you about my friends in that particular phase. Especially, we used to have that sort of a, because it has a bearing on my becoming a doctor, choosing my profession as a doctor and writing myself. We had good friends, very good friends, especially those, two of them, especially those who were my friends. They turned out to be a good writer and of eminence in the country, director of the NCERT also later on, our childhood friend, and his elder sister, who was I also used to call her Didi. She was a professor of English literature in Oxford University and also now in Toronto, and she's a big writer herself. So three of us used to play, and there has to be a game many times, and which called for sacrifice, which called for allowing others to win. They would allow me to win. Then I will allow them to win. But later on, there was a game called GKT, General Knowledge Test. And that gave me an impetus to take up the challenges. One challenge after another challenge. The incidents among one of our friends, when we used to go to play table tennis, was he fell down from the bicycle and got hurt. Now, this is a good bearing on my thing.
So you are a Gandhi Medical College graduate, sir.
Yes, exactly. So that time, I will tell you about the school thing immediately. So when he got hurt, he was given some medicine. He was not relieved. So I told my mother, as usual, and she said, give this medicine. And I said, who has, I went and applied it, and he was all right. And he gave a smile. And seeing him smile gave me so much of satisfaction. So I asked my mother, who made it? Who gave you this medicine? He said, civil surgeon, Dr. Saxena. I said, okay. Oh. So that's the reason I started writing that I'm going to be doctor and I'm going to be civil surgeon. That was the idea, basically. And you're right. And let me also tell you this particular thing. My life in the childhood was very different. I used to not only paint, I used to be shooter also, very good at aims. Well, that all days, they had a lot of bearing in my shaping as a person. Well, that was a picture which you saw myself as a teenager, as a medical college, when I have entered. When I entered a medical college in 67, I was a topper in my list of admissions. I was in the first in the list. And we used to have all the things, naughty things also. A lot of naughty things, especially when they would.
I'll show you some pictures of that time.
Well, let me tell you, when all the other girls will pass, we'll be sitting there and we all, yes, this is one of the picnics. And you can see me still trying to have a goggles and the scarf and things like this. Was our picnic at the third year picnic. And we are,
so this is what picture?
Exactly. And this was a first year picnic, no, second year picnic. Yes, we went out. So first time we were going out with our seniors supervision. So we enjoyed, dusted ourselves very well. So the picnic we used to have, we were batchmates of 150 people. Think of a class of that big. And we would be good friends, very nice people. Every person has got together. And I would always recall all of them. Unfortunately, many of them have gone up. They passed
Your
away.
college life have been very interesting, sir. And I came to know that you still keep meeting those friends.
Yes, yes, yes.
This is the
Ours is
picture which shows that.
we have a batch, GMC batch of our admission batch, and we meet every alternate years. Only during the COVID time we could not, pandemic time we could not. And out of that 70, 80, 90, whosoever are alive, 80%, 90% of them will join hands, which will come with our spouses. And I hear one of my friend who is in the specs here, he sitting next to me, he's no more now, Vicky, and we would go to different places in the country on a vacation. This was on, I think it was in, yes, it was in Himachal Pradesh. And we went all over for 4 days, 5 days we go. And we enjoy ourselves. At times Andaman, at times Goa. This time we'll be going to Goa again. So we enjoy. And you'll say we'll get together, we'll have a cheers. Also,
Yes,
no doubt
you
now
can see here.
I've left drinking, that's a different matter, but we enjoy it together, and it was means not only that, there's one person was a professor, somebody is dean there, and somebody is in USA who's a senior cardiologist, somebody is in pediatrics in USA, somebody is in Toronto, Canada, and most of the people are doing practice of all sense. But it was a nice batch, and we have such a feeling of seeing that all other people are doing so well. I always enjoyed this particular
This
thing.
is your group, sir. It looks like.
This is my group. I'm sitting here, no doubt. One after another, TN is there, Saxena is there, Taruna Saxena. Her son is now the national chairman of the National Child Council, or what was that? He's the, and there are people who are cardiologists. Then we have a neurology, physiology professors, dean, orthopedic surgery, dean, teaching, many of them are teaching. Another friend of mine, very close, who was with me in Delhi, is no more with me now. He's gone due to COVID now. This is a cardiologist from USA, and this is our sheet anchor of the batch, Dr. Nanda, Manmohan Nanda, who always keeps every person together. Very nice. Well, thank you for showing me.
Afterwards, sir, you came to AIIMS Delhi.
Yes, it was 76. I did MD, and next day, though I had a job offer from the state government, offered this appointment letter, but I did not join there. I left for Delhi. I wanted to do DM, and and neurology was my choice. My professor was very upset, Professor N.P. Mishra, that why am I doing neurology? He said, and some other person told me, you did everything in cardiology. Why don't you go in for cardiology? Well, then I came and met Professor Virmani, and this is our batch.
This is department picture, sir. Yes.
And Professor Virmani is there. I'm sitting with big mustaches that outside, and you can see Venkatraman is sitting next to Dr. Virmani.
Yes, sir. And I also recognize Dr. Mohandas.
Yes, he is also there. In fact, Mohandas.
Dr. Ahuja.
And Dr. Ahuja is there, definitely. He was our teacher. And well, this is our gap, and we had a good time. We had a very enjoyable teaching. And let me tell you, All India Institute of Medical Sciences is the best place where I have learned everything, anything for that matter. And why? Because the walls will teach you. The corridors will teach you. We're meeting people, talking people. The knowledge level goes up. You discuss people, and learning is everywhere. We used to have BD Dikshit library at the time. Now also, and we'll spend hours together. Okay, but let me tell you, my clinical medicine, basically MD medicine, was in Bhopal, and we learned maximum because we used to have a ward which was for 35 patients, and but there will be 22 patients on the floor, and you will take round on your goodness, on your knees, keep on. And it was enjoyable. I must say, we learned a lot. Many of the people, and we developed a sense of empathy and compassion. That's sort of crowd.
Sir, I would like to ask you a question. It's a question which every neurologist has to answer at least once in his life. The question is, why neurology?
Yes, that's true. That's true. First of all, why be a doctor? Then it comes neurology. I will tell you, because both of them, they are linked. All throughout my life, I had always enjoyed others' enjoyment. Later on, my classmates used to say, Begani Shadi mein Abdullah Diwana. Why are you didn't get it? He got the award. He got the century. But he played well. Whosoever does well. So I used to enjoy others. And this is one profession which I have seen, that child who had fallen down. You recall that? And who was not getting relieved. When he smiled, it gives me immense pleasure. So I said, this is one profession where others' relief gives you happiness, internal happiness, not earning money or something like that, but getting somebody relief was happiness, somebody in any field. So that's why I took up medical profession, because it would give me happiness. And then neurology. Neurology, people wanted me to take up cardiology, my batch, my teachers, everyone. And in fact, I went for rounds, but I don't want to say that, for cardiology professor known. And I came to this thing with all hats off to cardiologist. I had my stunt also. So I had all hat, but I came to this conclusion. It was more of a cleaning job rather than any challenges as such. So I was very fond of challenges in life, all throughout. So neurology, I thought it was full of challenges. That's the branch which will develop in future. And we must take that challenge. And that's the reason why I joined neurology. Because
I will tell you.
And there
I
was,
will tell you. Yes, sir. Sir, you speak first. Yeah.
There was every person would to say, "Hey, this is masturbation of gray matter. What are you going to do? Is all hemiplegia, stroke, or degeneration? There's no treatment available." So that nihilism has gone now. Right. I knew that nihilism will go and the mist will clear. And mist has cleared now. And we are seeing so many things coming up for therapeutics also, but knowing the mechanisms also. And society is getting benefited by neurologists tremendously. So more and more neurologists are required. So that because of the challenge, and I saw this is the challenge will improve. Life, I always take challenges.
Agreed, sir. And this is what makes neurology interesting, and that's why people are behind it. I would like to tell you here, somewhere in 1991, I came to National Medical Library. I'm a pass out from Allahabad Medical College. I came to National Medical Library, and I was surprised to see in the book section, half of the section was filled with neurology books, means something on brain. So that shows that there are a lot of challenges in the field of neurology.
That's right.
So this is very appropriate, sir. So I was told that even while you were doing DM neurology at AIIMS, you were selected by UPSC in 1978 as lecturer in neurology for GB Pant Hospital. How did it happen, sir? Is it true?
Yes, that's true. In fact, there were two posts of lecturer. See, previously we used to have lecturer starting point. That has been redesignated as assistant professor later on. So there were two posts of lecturer, and myself and Das and few more people applied, but both of us got selected. Myself also, Das had already done his DM, but I had not yet completed my DM, yet to complete. But then somehow or other I was selected, I was appointed, Das joined there, hopefully. Yes, I think so. But I did not join, because if at all I had to join, I thought I will join in AIIMS only, nowhere else. So we waited for my results in 79. The day result came out, same afternoon, I was appointed and I took as a lectureship there. Well, that's what it is. But then
later on, sir, immediately after doing your DM, you became a lecturer of neurology at AIIMS. That's how you told. But you left this in 1982.
Yes.
Somewhere in December.
In fact, I had still my...
So just the question is, sir, why did you not continue with the academics?
Yes, though I had my appointment letter of GB Pant still with me, I did not continue anywhere for that matter, for a very simple reason. Now he has a serious thinking, I will tell you. I discussed with my father, and you know what he said? Do you know what is academics? Academic is the state of mind. It is not a building. It is not an institution. And he said, I didn't believe. He said, go and see the Cambridge dictionary. He was dealing in English literature, mind it. So I
Yes.
went and saw. It said connected with studying and thinking, not with practical skills. It's like academic standards and someone who is clever and enjoy studying. Okay, that's what is the academic is. So it doesn't say that you're confined to a building or an institution. Even being outside, you can be an academician, which I wanted to become. And I will tell you, and I always wanted to be practical and with the patients. No doubt, every person in the institution is also practical and the patients. But then there are big, I was more concerned with the big capital P. There's a patient's P value, P value, but not the small P values.
Right, sir.
You
So
got
I've seen you
And
asking.
then only, I will just tell you more thing. The only
Yes.
thing which I would have missed is the number of people with me on the rounds, and the people try to help you out in different things, in writing or reading or some problem solving. But then here, this is important for private practice, I must tell you. Miss, what I missed, I'll tell you, teaching. So, but teaching is of three types. One is the targeted students who are receptive. Second are those who are sufferers, the teaching to the patient and teaching to their relations, and those who are sufferers. The third, who are not the sufferer but potential, the public. So these are three receptive areas where one can teach, and I had opted for the next two, which are larger population of the pupils, students. Not only that, here one can convert into layman's language what we had been reading in the research and the books and attending in the conferences, which every person does, but here on a bigger scale, because you get a little more time to explain it to the patient in the practice. You don't have a crowd like what we all used to have. You know, in my OPD in neurology, OPD in the 4th floor in the medical student block, you're supposed to finish at 4 o'clock, everyone, but mine will go at 5 o'clock, 5:30, 6 o'clock, 6:30. Occasionally it will go on like that. So what I would tell you is that important thing was that we can always have very open thinking about it. If a patient requires, he can get help from anywhere in the world in India. So that's why I used to call Professor Vadia very often in my practice, from whom I learned a lot while discussing the cases with him. Every month, 2 or 3 cases. That's the reason I still have been guided so much by his knowledge. Who would give a little bit of it, I could pick it up. Now, the only thing which I want to say is why I could not join is because of a particular Rabindranath Tagore sound. You know that?
Yes,
where
sir.
That
kindly explain it for viewers.
Where the mind is without fear. Where the mind is without fear and the head is held high. Where knowledge is free. Where the world has not been broken up into fragments by narrow domestic walls. You know, institution, what are narrow domestic walls? You understand that. Where the mind is, don't have to be a yes man. You can do whatever you wanted to do. And that's what I did. And that's the reason why I wanted to take up. So where the mind is without fear and the head is held high. Where knowledge is
free. I have seen you asking tough, challenging questions in various conferences, or while you are either as a delegate or as chairperson of the session. What is your source of learning which keeps you updated?
Well,
I will show you one picture.
That's right. That's
from your house.
Part of my library.
Is this the source?
Yeah, this is the source. American Academy of Neurology. Every year, I was the one person from 85 onwards. It is every year. And these, nowadays you get digital things, but at that time we had to carry all this, paying many times luggage charges, because so very heavy and volumes after volumes.
Sir.
That I'll keep on reading, but also listening to them and understanding. Not only that, when I go there, I will make friends, or try to, not friends, acquaintance, and requesting the seniors to be at their center while after the finishing the conference, so that I can be with them for 10 days or 15 days. And that's what I used to do. About 2 weeks, 3 weeks, I'll spend with them on the rounds and how they will discuss the cases, attending their discussions, and at different places, not only USA, Germany also. So that is it.
I'll show you another picture, sir. When I came to your house, I saw you in this posture.
Oh.
So this is, I came to know later that you are writing some book.
Yes, I am writing a book for last few months and busy with that. And so I have to be involved in many, say, after all, despite being all the laptops, there are 3 of them. I keep on seeing the literature and trying to write down. It is a tough thing which I'm doing. Later on, you will come to know after just a few months, wait, what type of a new thing is. It's a new concept.
Yes, you will wait for that, sir.
Sure, sure.
So as you said that you went to private practice at that time. This is time when there were very few neurologists in practice, and there were top class physicians who were practicing. So how did you make your way in that?
Well, you said a very, very important thing. That's it. When I started practicing, at that time, you know that any case of neurology in private sector would not be admitted directly through emergency or otherwise under a neurologist. It would be admitted under medicine people, even Gangaram for that matter. Everywhere, any other hospital. And because they used to say, what else? Because CT scan is negative. So CT scan negative means non-neurological. CT scan positive, there is to be 2 divisions, CT scan negative, CT scan positive. And so if it is CT scan positive, what will you do? It's a degeneration or it is a infarct. That's the question they used to say straight away, physicians. I don't want to name a very senior, very nice friend he became of mine later on. So, and the second point was, one was this, they would try to grab all the cases under them on some pretext or the other, or a patient had diabetes or something like that. But the second thing was, what is my term, which I used to be hating it. There's an FDP consultation. You know what is FDP? Fixed dilated pupil consultation. Fixed dilated pupil. Why? They have admitted a case in neurology, had gone into that stage of fixed dilated pupil. So they would say, let's put a stamp of the neurologist. So let's call the neurologist. That's it. And there were 2 people, 2 neurologists, Dr. Emert Suri, Colonel Suri, and Dr. Pant. Dr. Pant was he worked in Harvard, Boston. He worked with Adams and these people, and he was a wonderful clinician. So only 2 people were there. And then third, I joined.
Yes.
Yeah, all
must have been a difficult time, sir.
Very difficult time. So what I did was, I used to run from morning, 5:30, 6 o'clock, all over Delhi, different crisscross consultation. And the best thing was that when I joined Batra Hospital, I could convince Mr. Batra and the management, for that matter, that patients of neurology should be admitted under neurology. So neurology department was created there. And the first time in the history of private sector in Delhi, because of me, I started admitting patients. And then this concept spread all over. All other, gradually people fought for it, and neurology admissions started under neurology only. So that's how, and this spread to rest of the cities also gradually. This I'm talking North India. South and Mumbai, there was a little different story, which because I was not directly involved, so I can't tell you much about it. So this was my way of coming up to hit at the root cause, and it was a challenge again.
Remarkable work, sir. At several places, we have a department of neurology under which the neurology patients are also admitted. It's difficult to segregate from the medicine department. Right. So that's what you did in the private sector at that time. Yes, that is remarkable work, sir.
Thank you.
I would like to ask you, sir, you came to Delhi from Bhopal, and you started your career in neurology. So I would like to ask you, what has been your contribution to specialty of neurology?
Well, few firsts are there. First thing I have started. First of all, I will tell you, we all know that, as you know it, that from Neurological Society of India, Indian Academy of Neurology is separated.
I'll show you a picture.
Yes, that's right. That's right. So after the first meeting in Ranchi, when it was decided to hold it, to have a separate academy of neurologists exclusively, the second, nobody was able to organize it. It would have died a natural death because there were people in among our neurology only who are not so very keen for obvious reasons whether it will really come up or not. But I must tell you, in the meeting, no one else but dear Venkat, Colonel Venkataraman at that time, now General Venkat, he supported me and I decided to have it. But later on also I was told that because I am not attached to any institution, so how can it be done? How can you do it? But somehow or the other I did it, and good support of, in the previous slide, if you have seen, a good support of my friends, not only Venkat, but also by Mahendra. And we all went together. He was treasurer and Venkat was the real guide. Yes, you can see here. And I'll give.
You can see Mehndi Ratta in the picture.
This is Mehndi Ratta here.
And Dr. Suri.
Next to me, and Malhotra, and then we have Colonel Suri next to me. So we did it, and it was inaugurated, and the continuation of Indian Academy became live. Now we have taken out from the ICU. This became live, and now here we are in that stage.
We are at a stage now where we're going to organize 30th Indian Academy of Neurology conference this year. You can see here Dr. Chopra.
This is Dr. Jesipta, the brainchild, the person who really worked very hard to get this Indian Academy of Neurology going.
Yes.
He planned everything. This is Professor Devika Nag, a very senior person. And she was at Lucknow, KGMC. So she also joined us. Every person joined, no doubt about it. And we had a good show.
Sir, yeah, you since came from Bhopal, I would like to ask you, were you the first GM Neurology from the state of Madhya Pradesh?
Yes, you're right. I was the first DM from the state of Madhya Pradesh, and no doubt, and I set the trend path open. Gate was open for others. After me, the professor, my junior from Bhopal Medical College only, Professor Moli Nair, also joined, who was at Chitra. And
right.
The professor there.
I never knew, sir, that he's also passed out from.
He was my 1 year junior to me, a very nice person, 2 years junior to me, but a very nice person. And then there has been number of them. Now,
so it has been a long career for you. So there are several milestones which you found while coming to this stage. You were like honorary physician to President of India. And also you were awarded Lifetime Achievement Award by Lieutenant Governor of Delhi in the Delhi Neurology Association conference. And I'll show you some of the pictures which will remind you of that time.
Yes, every other branch especially used to have honorary physician to President of India. But I was the first one who became first neurologist to be ever appointed as honorary physicians or awarded as honorary physicianship.
I'll go to the picture.
Oh,
yes. This is from where you came.
Correct. This is Gandhi Medical College.
This is your,
this is my alma mater.
Alma mater.
Yes. Here. Oh, yeah. And this is,
here is the picture.
where I got Lifetime Achievement Award given by Governor of Delhi, Lieutenant Governor, who is in the suit here, gray suit. And this is a Delhi Neurological Association meeting there, annual meeting. And this was something which one enjoys, just feels proud. And this was
here we see.
I'm not able to get that hold of that picture. The whole album is missing. I was appointed first Miss President physician neurologist to R. Venkataraman, right?
Okay.
This is it. This is Professor Shankar Dayal, President Shankar Dayal Sharma. And then later on with Pranab Mukherjee also. I had certain photographs with him. And this was, I was awarded by the Chief Minister of Madhya Pradesh a couple of years back. And being the first DM from there. So that's the
By
journey, getting a few things. Well, you do get it from the patients. In fact, these awards are secondary, but the best thing, a smile of a patient who improves, comes out of any serious illness, meningitis, infiltrate status, and the family's gratitude. That is the biggest award which cannot be objectified and put in any frame.
so many people must have influenced you, influenced your life. Viewers will like to know who were the main influencers, whom you will never like to forget.
Well, as I
I'll
told
show
you,
you some of the pictures which will.
first, as always, who influenced me, and I will never forget, and the question doesn't arise, that my father and my mother were my
Okay.
teachers, best teachers. I must tell you that they are my best teachers, all, especially my father, who has been my architect. And then I have certain neurologists. So these are
Here
my,
we see your father and mother again.
right. Again, I tell you, they are my gurus also. I will tell for everything, for human values, human nature, they have told me everything. I was smoking for some time. Here only in Delhi, I got all these habits, never in Bhopal. So, but I started having beer also and drink. So that was also, they said, this is, you're taking it, tasting it. This is your choice, you're adult, decide about yourself. And which I have left now, this year only, totally left it. So
You
this
did
is,
right thing, sir.
then I must tell you, yes, she is my really mentor. I was telling you, she guided me. Others, my colleagues do not know, my other teachers in department would not know. She only told me what is the brain functioning exactly. She only made me aware of what is cognition. I would not read it anywhere. It was not given any book, what is cognition. She told me and made me into Varma, you know that you are only a spinal neurology, doing a spinal neurology. 2/3 of the brain only, but 1/3 of the brain is the real brain, for which you ought to. She had worked with McDonald Pritchley, right? She knows, she knew everything. So she told me, and I still bow before her soul, that she taught me, and not only she initiated me into neurology. Thank you, madam. And this is Dr. Professor Wadi. I told you, I used to have 2 or 3 cases in a month. I would call him and discuss with him, and thoroughly. Oh, he taught me, first of all, how he used to take history. I have learned it. I would see how he's taking history, how he's examining, how he's explaining to the patient. Oh, that was wonderful. I must tell you, wonderful. And no doubt, many times with Karthik and other people would know, when he has a little conference or everything meeting for neurologist or his group or some other movement disorder, or his friends will come from outside. I will also know, and I will join there. I will join there. So I will like a eklavya without giving a muta, right? From outside too.
I have also met him twice only in my life. A big man who worked on ataxias. And since I later on started working on ataxia, I still remember him.
Of course, we are proud of you. Still, you are an authority on that in the world. Right. This is my medicine, MD medicine professor, Professor N.P. Mishra, the head of department. He was not so very happy with me joining neurology, but then he accepted it later on. Very nice man. And this is Professor Jim Toole. Professor Jim Toole, who was president of the World Federation of Neurology, is a wonderful clinician who was a stroke man. We wrote books on stroke, and I had to spend time. I was lucky to have spent some time learning from him. And I'll tell you an incident now. His clinician astute. So he used to take me on rounds with him. He has to go. So one of the patient, she's lady, this time she was again admitted. Second time after she had one facial palsy, and again she was admitted. And this time she was having headache, vomiting. So she's a meningitis. They're suspecting meningitis. The president, every person presented it, and he saw his eyes. He said, Varma, do you see something? And I could see his way of looking at the thing. I said, yes, I saw that. He said, what do you think? He said, everyone, has anybody seen it? So one resident, a younger colleague, said, yes, I've seen some marks, skin patches. So I said, it must be allergy. some energy. He only asked one question. This is North Carolina. Did you go to your, she was 48 or 58. Did you go out somewhere in the last few months' time? She said, yes. Did you go to a New England area, Boston side? She said, yes, I went to Danbury. She said, there you are. He said, look for Lyme's disease in this case. And there you are, because of that particular lesion. And it turned out to be Lyme's disease, and treatable condition. So he told me, don't go by the symptoms alone, Amitaabh. At times he'll call me Verma. In the evening over drink, he would make a food for me. Twice he made a dinner for me himself, or by his own hand. Wonderful.
Very interesting, sir.
Great taste. So he told me, never ever go for label diagnosis. Go for the cause of the diagnosis. Go for that. Now, this is Professor Fred Plum, every person or coma person. I had met him in the American Academy of Neurology. Somehow or the other, my bad habit of asking certain questions. So one time he got hold of me and said, young man, you're from India. And he said, listen also, you'll get an answer. Don't only ask questions, listen also. So then I started this particular thing. I became very close to him, and he came to India because of my invitation and was here in Batra Hospital. I held a little, in his honor, we had a little meeting and presentation. Amina also came later on, but it was only for department. At that time, Professor Jagannath, I asked him what type of a man he is, what type of stay I should arrange. He said he would never come. He never goes to anyone. Professor Jagannath said he is coming to me. Not only he came, he stayed, and then became, when his one book, another book, when he edited a book on medicine, Celsus Lobes, another, the day it was published, he sent it to me with a beautiful letter also. So it was a wonderful person, very nice, very sharp, I must say.
Here we see Dr. Nalin Queen.
Yes, of course. He's a
story
good
behind
friend.
this.
He has been a good friend. Now he's emeritus professor now. So when he would come to Delhi, he would, we will definitely talk to him. After probably he has got beard now, looks like that. And he came to our house and enjoyed the Kashmiri cuisine, which my wife made. And they all liked it. It was very nice that you got hold of Queen also. Wonderful. Thank you. Very good.
So, we brought some very interesting pictures, sir.
But Achal, you know that he's also the same MSc dystrophy branch, or?
Yes, sir. Yes.
Of course, you know it. I don't know.
So let us deep into your family.
Oh, yes.
I have often seen so many pictures, family pictures, which you put on your Facebook page. It looks like that you are a real family man.
Yes, I am.
I have met ma'am on few occasions and found her to be very affectionate lady. So I would like to ask you, where did you find ma'am and where did you meet her first?
Well, her mama, who's in Ghaziabad, now is 80 plus. He knew my Chachaji, uncle, who's also no more. And so I had to get married to a non-medical. So it was arranged and I liked, and we decided to get married. That's it. Then very
nice.
Then the whole thing started. Well, I married my wife, Dalima, and who has been the turning point in my life, who is the source of my strength, energy, and motivation. And whenever I am in dilemma, not her name, dilemma, she would guide me correctly. She is really source. I'm thankful to her for all whatever I had done in my life, professional life. This is that was my first picture, was when I got DM degree convocation with my father and my first child. These are my 3 children who have now grown up. The one
we can see grown-up children as well.
She is now senior consultant psychiatrist at Vimhans.
Okay.
My daughter, she's at the Department of Dental Surgery, periodontist. Now she started her own hospital in Gurgaon. And this is my son, who's a brilliant innovator. He is a managing director and founder of a international world first thing, that is Intercell. He's one. He has gone the best among us, and I'm proud of it that he's doing so well. Not only that, let me tell you, not only that, he's earning tremendously. He has a good at heart. During pandemic, when people were laying down and people cutting the salary because there was no income, he did not lay down any of his 42 employees, none of them. Not only that, he gave them whosoever increment was due. And what he did was, that's something good. I think that's their blessings only, their family's blessings only, that now this time he has reached somewhere. It was something like what you have a unique thing like a Facebook or WhatsApp. So not on or not in that direction, but the uniqueness of that place.
So I'll show you another picture, sir. Extended family.
Yes, yes. So there's a pandemic time. Yes, of course. There's a now from 2 we became 3 means 5, 3 children. Now we have their spouses and children. So we have 12 of us now, grandchildren. We have 4 grandchildren, and we have our son-in-law who is a radiation oncologist, right? And my another son, he's a now national, international maxillofacial surgeon who's called for aesthetic surgery everywhere. He's one of them. All the 4 of the children, grandchildren. And then not only that, my bahu she's a HR specialist now looking after children.
Another picture.
The picnic, we will every vacation we'll go out together. We had not only there India, but we go abroad also. Scotland, we went outside, we enjoyed it. And then
this looks like somewhere outside picture.
We take a Mercedes Sprinter 16 thing, and we can go anywhere. We enjoy it.
Okay. So it doesn't stop here. You have been a multifaceted person with a plethora of talent. Hidden inside you is a brilliant photographer. I will show you some of your photographic wonders.
Sure. Sure. Well, this is a trip to photography.
Yeah.
This is on beach. Yes. This is my, because I'm a photographer, my grandson. They're very keen on seeing how to take.
Must be developing into a photographer.
Yeah, exactly. Budding into that. And
this is marvelous.
This is a view for Qutub Minar. This is a photographer's view. I had to go to a ditch. There's a little nala sort of thing, low down. I had to go down, and from there, there's arch of that. I have to take another arch and take a photograph from there in the night. So this is.
I've not seen this view, sir.
This is something different, which is.
This is another view.
Another view of the night for the Minar, for the another different arch. So these look very nice. And Qutub Minar in the night by light is a beautiful thing. I must say that. I enjoy photographing that. And this is architecture in that area only. And pillars after pillars, pillars after pillars. And the arching, it tells you that this is some sort of mandir or something like that. It gives
the angle is very nice, sir, from wherever you selected this angle. And then it has been taken by somebody else, whosoever was there at that time. But the view angle is very nice.
Actually, you also have a photographic eye. So I'll tell you.
Yes, sir.
It's not only the structure we have to focus, you have to take the total environment. And
yes,
like this is a London Bond Street area in the night. You'll enjoy that. Or this is Edinburgh Castle from inside.
Okay.
You can see Edinburgh Castle. And this is
very nice view again.
They will enjoy that. They'll enjoy that.
Oh.
This is my son-in-laws, 2 son-in-laws walking.
Here we can see shadows on the road.
Yes, yes, of course. This is what happens in life. You see the shadows, lights. Oh, this is our vacation too. And you will see that who's taken the photo. I have taken it. I carry my what you call as a tripod. Fix it. Take it. There's a remote. There would be a remote which I'll use. So this is a pyramid. Oh, these are. This is a wonderful structure, pyramid in there. I have taken the photograph in the night, but because they could consume more time, so I did not, probably not included in that. But then the pyramids are wonderful structures. One must visit that. One must. It is enjoyable. And
show you another picture.
Yeah, this is the one. This is at 3 o'clock. There's the sun shines on the top. Everything. There's the sun shines, and this is supposed to be. That's why pyramid vastu is also being used, for it has certain angles which are very energized angles. Those are the actual things. And this was the last visit we could make it before pandemic. That was
Oh,
19 December. Because twice a year or thrice a year we can go. But we
uh,
used to go, but now after pandemic it is over. And this time, let's see where we go. Because they're not giving visa now so easily.
yeah, these days it's become difficult.
Correct.
So these were photographs were very nice. But I must say, uh, in some time, or I would say that there are so many pictures which I have seen with you. We can have an exhibition on that in India Habitat Center or somewhere.
Sure, sure. I'm going to have on different things. Oh, yes, of course. Different
So
themes.
apart from this, you have certain more interest like gardening. Let us go to your garden.
Oh, yes, of course. I enjoy my garden. I enjoy, oh, yes, that was the one time which I spent. This is a show.
There are some more pictures of
This is Edinburgh,
outside.
Edinburgh, Scotland.
Yeah, yeah.
From within the car. I said, this is a what we call as a glacier on the top of Alaska.
Yes,
Oh, yeah.
very
This
nice
is, this
pictures.
is not
Yeah.
Alaska, this is Almaty.
Ah,
Almaty topmost portion.
okay.
No, my wife enjoyed. Oh, this is my beach, our Goa beach where we used to stay.
Oh,
And this is something.
yeah.
You will see the evening on that Goa beach. It's beautiful.
Beautiful pictures.
This is my
We
garden.
start with your garden now.
Yes, this is my garden. I enjoy this.
Some of the very nice
I'm sure there are
pictures.
many more better photographers in our association. We'll have some group. Oh yeah, these are the photographs of a different. This is.
This is, I think,
December, January come, you'll enjoy that.
very nice picture which shows your garden.
Oh yes.
Very nice flowers.
These are jawel.
This is a view which shows the whole garden because I have visited your house. I know.
Right. This is good for having get together anytime. If you want, we can have.
We will have, sir.
Over 200 people easily. Oh, this is from Alaska. The
Okay.
golden eagle, the bald eagle, they call it. This is golden bald eagle. This is something Alaska. But there are a number of them, and they're very interesting. See that. I had seen a whale also, and this is Juneau area. From Juneau, there's a special thing. You take a boat and you see the whales. Oh, that photograph also I have. How the whales are throwing jet water.
Okay. So, as I said that you have been a multifaceted person. You have represented university cricket, table tennis, and you are a known astrologer of repute and a Vedic scholar who used to deliver talks I have personally seen with Mahesh Yogi.
That's
Am I
right.
right?
That's right. Absolutely correct. I used to give some physiological explanation, neuroscientific explanation with Maharshi.
This is Mahesh Yogi.
He made me understand the Rigved, especially Rigved. What is the gap, Rig, and what is the gap between the two synapses? That is where the life is there, versus Chetna is there, consciousness is there. That's what it is. Spandan, that vibration, that what we call as the mu rhythm. So he had this sort of vision. He knew about the science, for that matter. That was 98. I used to speak with him on the channel. And oh yes, this is Amma. A whole hospital has started. She had blessed me so many times. In fact, not only that, she gave me a month in my ear also, what has to be done, what I should do. And I'm so grateful to her for her blessings. So Maheshi, see, I had been going to all the people because I knew a little bit. So I would try to understand, and somehow they would allow me to be with them closely. And at different areas. So I used to call ke, bhai, main to wo hum, nadi har ghat pe jaake pani pee raha hu. Oh yeah, this is the mantra she's giving me. This is something very unique thing. And I'm blessed because of that. It has changed
Interesting moment, sir.
thinking. And this
I
is
see here with Sadhguru.
Yeah, Sadhguru, we had a very good discussion for a few minutes, going into 1 hour and more. I think we discussed and discussed and discussed about different aspects. I was reading Upanishads at that time, And he is the master, he is the knowledge personified. So he would speak everything from his knowledge. Oh, wonderful, wonderful. He made my so many points clear. And this is a Maha-avatar. Maha-avatar is supposed from Himalayan Logi. Now he's putting on these things. But then he has from Himalayan caves. And many of that, like Rajnikant, and every person is his pupil. But then he met me and the thing like developed a liking for me. I've been to his Palampur ashram. In fact, when one day Nirmal Surya rang me up, I was at his ashram only, on the top when he rang me up at that time. So that's what I had been doing. That's the reason why. Oh, and this is my really guide for that matter at the present day, how the mind has to, brain has to develop into spirituality, and what is the way of the, I should reach my objective of life. That is Anand Murthy Sarkar. That's a beautiful thing. Yes, Babaji for it. Thank you.
So it's been a long journey, sir. Can you tell us some lifetime memory which you like to tell to the audience? Some lifetime memory.
Lifetime memory regarding personal life, or life, social life, or it is a professional life?
Sir, all the three.
All the three. Then it will one after another, one after another, one after another. But then one thing which I would like to say is very clear. You will laugh also. I also don't know how it happened. There was a, in fact, I should have brought you that thing. A professor of Urdu, he was in coma, brought as a meningitis, meningoencephalitis, turned out to be herpes simplex. That was it was in a Batra hospital only, 86. Remained in coma for 3 months. Then gradually started coming up, came out unscratched. Not that we do the same thing for everyone, you also do the same thing for everyone. But he had to come out, so he came out. And when he came out, you know that most astonishing thing, he told us everything what we used to talk.
Oh, quite
How
interesting.
that happened, what happened, and how that person, he even told me that except the next person, which that lady who was transferred from Masjid Biawar, this place, and she died because of fits only. You all had been wondering why. She had convulsions and she choked. Nobody knew about it because there was people were busy with another CPR. He knew each and every. Not only that, he told us about a few naughty things also what people would be doing in the ICU. So I was amazed. Now this is a thing which our objective science does not believe. We should
Yes.
not. We should not believe. As a science, objective neurologist, I would not like to give a wrong impression to people. But then there is something more than objective science. This, I believe in that, because you have electrons going around, moving in protons inside a matter. What is the energy of that? In inert matter also there is electrons. What is the energy in that? So there's we will talk about it later on, which I'll speak some other day. But what I'm trying to tell is that these things do happen. When it happens, you say it is one of those things. But then he wrote a very beautiful shairi for me. He wrote a shairi for me in Urdu, pure Urdu. That was worth it. And for certain things in life, say after all 50 years of practice is not a joke. You all do come, I'm sure every person must have come across so many of the weird things. But it does happen. Not only that, I can't name the person who was politically very sensitive in that particular time of, and we're supposed to, I diagnosed that particular thing, otherwise he was going to be treated as psychiatric and pushed, hushed inside the carpet. I said, no, this was a stroke, non-paralytic stroke in the language area, and we proved it. The moment it was proved, Ratan Tata, as the managing director of Air India, organized a flight in the night and was shifted to Beach Candy. I won't tell you the name because it's not correct to tell you the name. But the things do happen in our life. present life. But the important thing is, I'm very open to learning, especially for my younger colleagues. I learn from you. When you speak so many things, I learn from you. I've somehow the other, Achal, I must tell younger colleagues also, learn this thing if you can. I don't know how I learned it from the time. Enjoy others' progress. Enjoy others' progress. Let the other person grow. You enjoy that growth. Be connected. It's a social neurology. And we are all interconnected. If you enjoy that, it's another source of enjoyment for you. You don't lose anything. You gain only. That's one thing I like to say.
So is this the message which you would like to give to our younger viewers?
No, younger neurologists, I would like to give one other message.
Yes, sir. They will be very keen to listen to it because you have given almost 46 years to neurology practice.
Yes. Thank you. Dear friends, I had also been like you. Every person has to go through these stages. No doubt you are passing through, many of you are passing through a new type of medical system, which is the managed care. In the corporate hospital, the managed care,
Yes.
where the patients come second, something else comes first, and also our production comes first. The patient comes second. You're passing through that area. But don't forget to take history. Detailed history. Don't be what I'm trying to tell, this is the main message. Don't be a techno-physician. Don't be a techno-physician. Be a clinician. That all the investigations have a value, very tremendous value, but the value of a zero. Zero is effective only after figure. After 1, it becomes 10. After 10 or 120, it becomes 1200. So zero. And what is that figure? Figure is the patient history and examination. You correlate that. Sometime or the other, whenever I have given a chance and occasion comes, I tell them very often that, look here, don't, hello. Hello.
Yes, you are audible, sir.
I can't see. I can't see.
You are audible, sir. You can continue.
Okay. I'm not seeing myself. Well, I want to, can you see this, my video? Because there's the
Yes,
time.
sir. Yes, sir. Yeah, it is visible, sir. Yeah.
These are
also visible to us.
These are the shadows.
Yeah.
I said, don't believe when these cat scan, dog scan, and rat scan.
Mm-hmm.
Because these are images, MRI is imaging. Or this is an image of a hand. Is it black hand or white hand? Male or female? Dead or alive? 40 years, 70 years? Can you say that? Similarly, you should not comment on the MRI without taking the history and examination. This is very important. Don't be a techno-physician, technology-oriented. First be a physician, then let the technology be your slave. This is the only message we'd like to give. Because I'm finding very often this is happening. Thank you.
I hope the young brigade will surely benefit with your message. With this, we conclude today's talk show. I am sure each one of you would get some or other interesting and inspiring points from Dr. Amitaabh Varma's life. I wish him good luck and healthy life. Thank you, sir.
Thank you very much, Achal, and thank you all the viewers. Thank you very much.
And in the end, I will again thank Indian Academy of Neurology for this kind of legend show.
Yes, I would also not forget to thank Indian Academy of Neurology, especially two people.
Sir.
One is Nirmal Surya, my friend, and the second is Gagandeep Singh. Why? Yes. Because I started doing something first in Indian Academy of Neurology, the contemplative neurology.
Yes, I remember.
Contemplative neurology is a new concept, new thing. It's the first time in the world which we have started. And that is to see the different functioning of the brain into over a consciousness level, right? And I can discuss it later on, what is contemplative neurology. But that is because of Gagandeep's encouragement, and he agreed for that. Thank you very much. When he was secretary.
Thank you, sir. Thank you, sir. And I thank all the viewers who were there with us throughout your journey, which we saw here. Thank you, sir. Thank you, everyone. Good night.
Good night.